It can be very frustrating working with patients with chronic fatigue syndrome, particularly as you can get into arguments based on their preset ideas about what causes the problem and what sort of treatment they want. This video is going to help you manage these patients, and it's going to give you lots of practical tips so that your patients with chronic fatigue will be more satisfied. Dr. Trudy Chalder is a specialist in chronic fatigue syndrome at the Institute of Psychiatry. Right, so we've got these people that come in to see us in general practice with tiredness, and then, you know, we've excluded anemia and underactive thyroid and things like that. How do we then know whether it's normal tiredness or at the other end of the spectrum they've got chronic fatigue syndrome?
Well, the main differentiating characteristic between normal tiredness that we all feel from time to time and chronic fatigue syndrome is the disability that people are experiencing. And sometimes we see people in our clinic who are completely disabled, i.e. they're bedbound most of the time. And at the other end of the spectrum, there's people, the CFS spectrum, there are people who are managing to go to work but are doing nothing in the evenings and then collapse all weekend as a result of the tiredness.
Right.
So it's people who get into that all or nothing approach to activity and everyday life that you need to worry about.
Right. So how common is chronic fatigue syndrome as opposed to normal tiredness?
Well, chronic fatigue syndrome is not that common. About 0.2 to 0.5% of the population fulfil the criteria for chronic fatigue syndrome.
Right.
Although I have to say it feels a lot more when you think about how many people we're seeing in our clinic.
Right.
And about 10% of the population feel tired all the time.
Right. So the average GP with a list of about 2,000 patients might expect 3 or 4 patients,
Yes.
possibly with chronic fatigue syndrome,
Yes.
but literally dozens with tiredness up the other end. So if we can focus now on the chronic fatigue syndrome a bit more, what are the sort of the key criteria? How would you make the diagnosis?
Well, obviously the main thing is whether the person's experiencing physical and mental fatigue. They usually will say that the symptoms are made worse by exercise or activity, and so as a consequence of that they will have reduced what they're doing in response to the symptoms and will be substantially disabled.
Right.
And in order to fulfil the criteria, it's an arbitrary cut-off, but they have a 50% reduction in activity levels.
Ah, okay, right. Over what period of time?
Over a 6-month period.
Right. To show you how a GP might assess a patient with possible chronic fatigue syndrome, we have reenacted an actual consultation. The GP is Dr. Jenny Law. The patient, for reasons of confidentiality, is played by an actor.
Vince, hi, how are you? How have things been since I last saw you?
Bit worse, actually.
Oh dear.
Yeah, that's why I'm here again. It's actually quite a lot worse than when I last saw you.
In what way? What's been happening?
Much more tired, much more exhausted than I was, and it's beginning to quite seriously affect work. I'm having quite a lot of time off sick at the moment.
How much time have you had off in the last month?
Probably at least 1 day a week, quite often 2.
And what do you feel, what's actually stopping you from going to work? What's happening?
I'm just waking up in the morning feeling like I haven't been to sleep, utterly shattered, very hard to get going, and even on the days when I do get going, it's it's difficult. But a couple of days I just can't make it at all. Can barely get out of bed.
Right. What about in the evenings and at weekends? What's happening then?
I'm basically just recovering because I work as a teacher, and there's quite a lot of homework that we're supposed to do, and barely up to that. And after doing whatever of that I can do, I'm just crashing out, and going to bed about 9, spending a lot of the weekend sleeping, basically.
And in terms of having the time off work, what do you think is actually stopping you from going to work? What's happening with you? Is it that you just feel you can't, or?
It's not so much a matter of feelings, it's just that if on a day when I'm feeling really bad, if I push myself too hard, then it just knocks me out. Like if I try to go to work on a day when I'm feeling that awful, I wouldn't be able to go to work for the next 4 days if I push myself too hard, because it just completely knocks me out.
And are you able to do any social activities, get out and see people? Or?
I'm trying, because I'm aware of getting quite isolated at the moment. I don't want that to happen, so I have been trying to see people, but that's becoming more of an effort than it was. I can do it and enjoy it at the time, but if I stay out too late, then it knocks me out for a couple of days. So again, I've had to stop doing that, or I've had to cut it down quite a lot.
Right. And Vince, I'm sorry, I can't remember. Have you got a partner at home? Have you got support, or is
not really? I mean,
there?
again, it's like most things are becoming difficult. Managing the house, cooking, really basic stuff's actually at the moment very exhausting.
Right. So, have you any ideas yourself what might be causing this? Thoughts?
Well, I've talked to a couple of colleagues about it, and to me it sounds very like ME, which I don't know an awful lot about. I've done some reading,
Right.
but to me, from what I've read and from what I've heard, it sounds like I've got ME.
Well, from what you've told me, and the symptoms with the muscle pains and the fatigue and everything, I think you may well be right. It's what I would call chronic fatigue syndrome,
Right.
Which is essentially just another name for the same thing. It means the same thing to the medical profession. What sort of things have you read about it?
Nothing particularly consistent. I mean, what I can make out is that it seems to be caused by a virus, and it's caused by a virus that has in some way damaged my nervous system or my muscles, which is certainly what it feels like. It feels like my muscles are damaged. I used to do a lot of sport, and I can't do that anymore. My muscles feel very different from what they did.
Right, well, what I can tell you is that certainly in the past people have speculated about the link between viral infections and ME, or chronic fatigue syndrome, and there's no definite link between one and the other. Most common viruses are known not to be the cause of it, and it's thought that people who become fatigued and have this, there are a whole number of different reasons coming together, and therefore, if you did have a virus some time ago, which you link with this, your body would have cleared the virus by now. So there's no actual evidence in chronic fatigue syndrome of nerve damage or anything like that. So in that respect, there's no drug treatment as such for an infection that we would give you for it.
So there isn't actually any, because that's how it feels. It does feel like there's some kind of physiological damage.
Well, I mean, your symptoms, the physical symptoms are real, obviously, but there is no underlying nerve damage in chronic fatigue syndrome.
Right. So what can we do about it?
Right. Well, there is treatment that can help, and I can give you some advice about that. So.
Trudy, what was the GP doing there with Vince in that illustration that we've just seen?
She was doing 2 or 3 things. The first thing was that she was finding out how the fatigue affects his everyday life, and essentially how disabled he is.
Yes.
She also wanted to find out what he feels has caused it, because that may be important in terms of how well he'll engage with treatment, which I'm sure talk about.
Thinking about what she was talking about his beliefs about it, is it important to sort of put somebody right if they believe that it's due to a virus or another reason? Does that help?
No, I don't think it does. I mean, I think it's important to incorporate that belief in a more sophisticated model of understanding the illness that you would share with the patient, if that makes sense.
Right, yes.
So for example, it might be the virus in conjunction with a number of other factors which contributed to the development of the fatigue.
Yes, I see. Now, with viruses, I mean, clearly there are some viruses that really do affect you badly, aren't they? Like the Epstein-Barr virus, for example. What do you normally discuss about viruses with patients at this sort of part of the assessment?
Well, some patients worry that they've got some virus lurking in their body that's still there, months after the initial viral infection has gone away. And so it can be important to tell the patient that serious viruses such as glandular fever, hepatitis or meningitis, that they can cause fatigue 6 months after the onset, but that again it's likely to be a number of factors working together that causes the severity and the chronicity of the fatigue.
Right, right. And also in your assessment, what other things would you be looking for in terms of perhaps comorbid problems?
Well, the important thing from the GP's perspective is looking for depression and anxiety.
Yes.
And we know that up to 75% of people, both in primary care and in hospital populations, those people with chronic fatigue syndrome also fulfil a criteria for depression or anxiety.
So in that case, should the GPs be treating people with antidepressants, whatever, or should we be targeting particular patients for treatment, concurrent treatment with antidepressants?
If the diagnosis is clearly or primarily depression, where the person is experiencing loss of enjoyment, then I think it would be worth trying a course of antidepressants.